He said, as one of the most constipated people I know, he says, you'll not only help yourself, but help thousands of other people if you'll just make up this formula. And I said, okay, I'll take the assignment. We followed through, and we found step by step just what was needed. It came to me over a period of time, and we found out that every patient that came to me that was constipated had one big problem, and that was the peristaltic muscle didn't work. The peristaltic muscle must keep working and knead out the fecal matter up the ascending, transverse, descending, sigmoids, and on out. Keep it moving so that we don't have to blast it loose. And this particular thing, I had to find an herb that was qualified to do it, and we found that Cascara sagrada was the herb. It is the herb that feeds the peristaltic muscle. Now, when I talk of peristaltic muscles, as most of you know, it's not just in the lower bowel. The peristaltic muscle is in the small intestine, it's in the vein, it's in the artery, it's absolutely in the nervous system. The peristaltic is there, but it becomes starved, hungry, it becomes constipated wherever it isn't fed properly. And so Cascara sagrada did the job for this. But barberry was the next one. And the reason we used barberry was because show me a sick person, we generally have a liver problem. And the barberry is the activator for the liver and gallbladder area. It gets the bile flowing. It cleans it out. We also found out that we needed a few other things. And one of them that we needed in this formula was golden seal. A very small amount. But it was there for infection. We needed cayenne. There as a stimulant. And to stop the bleeding. And to act as an accentuator. We needed lobelia. We needed, step by step, the various things. We needed sweet fennel seed. And the sweet fennel gets rid of the gas. But while it's getting rid of the gas, sometimes we have a few problems. The gas rolls around and we get pains. We had to put in Jamaica ginger to offset the pains because it's an antispasmodic. The only actual laxative that's in that whole formula of our lower bowel tonic is turkey rhubarb. Turkey rhubarb, also called China rhubarb or India rhubarb, is so mild it's called an aperient. It is so mild that you can make up the tea and feed it to a little constipated infant that's screaming with constipation pains. And just give some of this for a little period of time, and the baby will quit crying, start laughing, happy. Why? Because it's just had a great big BM. And you've got to clean it up. It doesn't. It's too young. But it works just this way. That's how mild turkey rhubarb is. And that's the only true laxative that's in this whole formula. But it works, and it is not habit-forming. And the reason we have used this formula because it follows through every step. As a true herbalist, we're supposed to use, number one, there is not one herb in that formula that is toxic. Number two, there is not one herb in that whole formula that is poisonous, because we do not use poison herbs. And number three, there is not one herb that is habit-forming. You know, the habit-forming herbs are the ones that we have to be careful of, because we do have herbal laxatives that are habit-forming. We do have many things that are habit-forming. Well, I should know. Great balls of fire. None of you will ever have to take Phenamint or X-Lax, Epsom salts, castor oil. You won't have to take any herbal formulas for laxatives at all, because I use enough for all of you. We have a formula here that is good enough that we've had so many people enthralled with it. We had a Jewish fellow, I have to tell you about him. He was an interesting soul. He and his girlfriend had been coming 3 years to our classes. We have a series of weekly classes we used to have that we would have preliminary herbs and advanced herbs, and then we'd have iridology and reflexology and on through the whole list. And they had come to learn about our holistic program and holistic means where we can help people without doing them any harm, no damage. Because they wanted to learn about taking these formulas and programs back to Israel. They were going back there, and they wanted to go back there and practice. He said, you know, I'm kind of confused with this program of yours. And I said, why are you confused? Well, he said, I've been with you now, this is early in this program, 11 months. And when I first started in your program, I was so badly constipated, he said I would have one small bowel movement a day, some days. But he said I ate like a horse. He said I would eat 3 or 4 times as much as most people. And then in between meals, I was always hungry and I was always snacking. And I could never get satisfied. And not much energy. Well, he says, I've been on this thing for 11 months. I eat less than 1/3 of what I used to eat. Less than 1/3. But he said, I'm having from 5 to 7 immense bowel movements a day, where I used to have one little one with eating 3 or 4 times more food. I can't figure this out. Well, I said, being of your nationality, you know nothing to worry about, because if you're getting something for nothing. And he said, oh, come on, cut it out. Tell me what's happening, what's actually happening. Well, here we have the bowel, and I drew him a picture of how that it accumulates toxic poison. It accumulates waste material and layer upon layer of paste, which is our white flour products and et cetera, Twinkies, and a layer of that and a layer of fecal matter and another layer of fecal matter. When you cut that descending colon in two in autopsy, it looks like an old tree cut in two. And I said, what we're doing is softening up the middle part. And the more liquid, because he was with the rest of them, he used 1 gallon of steamed distilled water a day plus the formulas. I said, what you're taking out in 1/8 of an inch is what is accumulated in there and impacted in there in weeks and weeks. And I said, you've got 40 years stacked in there. We do recommend storing food for bad times, but not in your bowel. Well, he began to get the picture. And he had more pep and energy than he'd ever known before in his life. It was not habit forming, because everyone that comes to us as patients go on our basics, which are, number 1, as we have mentioned before, 1 gallon of steamed distilled water a day. Number 2, clean out the bowel. Number 3, clean up the bloodstream. This is extremely important, but they must go on the 3-day cleanse every 30 days. 3 days of juice every 30 days. And the mucusless diet. Well, he had followed through on this. And in this program, he had tapered from 1 small bowel movement, sometimes once a day, to 5 to 7, and he leveled it off to better than 3 bowel movements a day the rest of his time, as long as I knew him. 3 bowel movements or more, and they do not have to be formed. They can be a spore type. When they are formed, it means there is still mucus in there, and it's doing too much forming. And this we want to eliminate as much as possible. We've got now a formula that should be with every one of your patients, every one of your friends, to, number one, clean them out, because they're 90% of all disease starts in the bowel. Then the bloodstream with your red clover combination, and then give them the fruits, vegetables, grains, nuts, and seeds in their wholesome state, and you have got the program on the road.